Hello, this is Eric Topol for Medscape Medicine and the Machine podcast. And we've got a phenomenal guest today, Professor Hannah Wunsch from the University of Toronto, who authored a book called The Autumn Ghost. And I had the chance to review that for Nature. That was published, I think, in June. So welcome, Hannah.
Oh, thanks so much. It's such an honor to be on your podcast here.
Well, you have an incredible background, which I only learned when I was getting ready to have this first real meeting with you, having gotten to know you a bit from your writing. But you're baccalaureate at Harvard, the London School of Hygiene and Tropical Medicine, and Washington University for your MD, Columbia for Anesthesiology and Critical Care Medicine. Wow. And then you migrated to Toronto. Are you a Canadian?
I am now. I'm a Canadian citizen. That's a relatively new thing for me, and feel honored that they accepted me.
Well, Ray, you've definitely been lighting it up there, so they should be very proud to have you as part of the institution of the U of T, really one of the great systems of medicine and healthcare in North America. What I was just perplexed, and this is, well, for me, the real nuts of some of our discussion, is how in the world were you able to go back in history 70 years in Denmark and dig up all this stuff about polio? I mean, it's hard enough to do it currently, but you did this in detail. You had the photos you had of the kids who were hit, the poetry that some of the patients wrote, all the news clippings, and we're going back to 1952 and thereabouts at the physician warfare, ego, how did you do it?
Well, it's a little bit of a treasure hunt, and I have to say I loved it for that you you start scratching the surface and digging, and you just never know what threads you're going to get to pull on and where it might lead you. And for me, the real thrill was getting to find the people who were there, who were eyewitnesses, and also digging up film footage, which of course you can't see in the book, but I used as resource. There is film footage of the epidemic. And it turns out, Danes are kind of famous for their great archival material, I think, in general, and great records in general. And so they did have incredible archival material in the city archives. They had the one that always sort of sticks with me is they had, for me, the book of all of the deaths in 1952 in the one hospital where these events took place. And to be able to page through that and see this sort of, you could reconstruct so much from all of this. But fundamentally, at the end of the day, it was really the people and getting to talk to people who were there.
Wow. And that was that the Bleikdam Hospital?
Yeah, it's actually pronounced Blydam in Danish. So, trying not to offend any Danish listeners, but it's spelled as we would say Bleikdam. Yes. It was the infectious disease hospital for the city of Copenhagen and the surrounding areas, and became the epicenter for this now, I consider it a famous polio epidemic in 1952.
Oh, yeah. Well, you made that very clear. That and so many of the things that we're going to talk about are quite compelling. Do you have a Danish descent background?
Not at all. I speak not a word, and I'm terrible with languages. So I would say that was, in many ways, the hardest thing for me was not speaking with people, because everybody there speaks English, but dealing with archival material in Danish. You'll appreciate this as someone who loves AI or is interested in AI. Is Google Translate is phenomenal. And so actually I was able to read huge swaths of material in Danish just with Google Translate, and then was much more careful for anything that ended up in the book where I got actual individuals to help me translate. But so my interest in the events there and Denmark and Copenhagen was really through the events of this epidemic and my interest in the medical history.
Wow. How long did it take to do all the research?
I think it was 3 to 4 years in total. In a weird way, I was helped by COVID, because while we were very busy in the hospital, I work in the ICU, there were also these very long stretches of downtime when I was just at home, obviously not doing normal activities. And a lot of older people became familiar with Zoom. And so I was, in fact, able to do a lot of interviews with people during COVID, during lockdown, because everybody who was at home with nothing else to do. And people who wouldn't have been facile with that sort of technology before were able to hop on Zoom and allow me to interview them. So I was able to do a fair amount sort of preparation work before I even went over to Copenhagen, Denmark to do research in person. So it's an odd silver lining to the to COVID.
Yeah. Well, yeah, we're going to talk a bit more about how the parallels between COVID and polio. But before we do that, what I didn't know was, the world of the ICU and how it's basically birthed by polio. I had no idea. I mean, I had to envision, like you portrayed, it was actually remarkable how when it was discovered about positive pressure ventilation, and then you had all these medical and dental students that were bagging the patients around the clock because there was no such thing as a mechanical ventilator. Something like 50 of these students would be breathing basically like an ambu bag or whatever.
Yeah, it was an early
patient. Yeah, I mean, just wow. These are things that I had no clue, but also the fact that it was thanks to polio that we have such a thing as ICU appreciation for not just blood gases, mechanical ventilators, the interdisciplinary team, the respect for anesthesiology. Can you kind of take us through that? I don't think a lot of people really know how this all came together.
Yeah, I agree. Even my own specialty, which is critical care medicine, a lot of people didn't know this story, which is really the origin story for the specialty. And, to put it in context, of course, there were other people and other factors at play that were pushing things in this direction. So I think it's important to recognize that although I tell sort of a single story, is never quite that simple. But, in the early 1950s, one of the things I had to appreciate, understand, was just how little there was to do for people who were critically ill. There were iron lungs for people who had polio with respiratory failure, but if you had bulbar polio, where, difficulty swallowing, all of that, it was 90% mortality for those patients. And so I stumbled on this story in a book called The Rise and Fall of Modern Medicine 20 years ago, which tells this story as an important pivotal moment in medical history when there's this major epidemic of polio in Copenhagen. And they've seen a lot of polio over the years, but nothing like this. It was a particularly virulent strain, and it was just hitting an enormous number of people. And the incredible statistic that by the time the epidemic was over, 1 in 200 boys aged 1 to 4 had been paralyzed by polio in the city. And they had one iron lung, but they also recognized that iron lungs were not the solution because so many patients had bulbar polio. And the book really, it's about innovation. It's about early innovation, but it's also about modern innovation and sort of the important factors for something to occur, like this major leap in how to keep people alive. And in this case, it was bringing in an anesthesiologist by the name of Bjorn Ibsen. And at that point in time, anesthesiologists were not, they were barely a specialty in Denmark. In fact, they were just recognized a year or two earlier. And they certainly were not involved in the care of polio patients. That was the domain of infectious disease doctors, maybe sort of neurologists, but certainly not anesthesiologists. And he's the one who came in and suggested, let's do a tracheostomy on your patients. I think this is carbon dioxide retention that's killing them. And if we just take the techniques of the operating room where we keep people alive with ventilation and apply them to the patients with polio, I think I can save, many of your patients. And so that's really the crux of the story, is what it took for them to let him try this. And then, of course, you alluded to the involvement of ultimately 1,200 medical and dental students when they realized they had a technique that worked, positive pressure ventilation, but they didn't have ventilators yet. And so to me, it still gives me sort of shivers every time I imagine being one of those students sitting at the bedside, and they did in 6 to 8 hour shifts, 24 hours a day for months. At one point, they had 70 patients kept alive this way. And so it's really it's a great story, but it's also an important story, I think, for people to understand actually how recently we didn't have these basic interventions that we consider part and parcel of modern medicine.
Yeah, no, the polio transformation to modern medicines is incredibly well captured. And there are a couple of passages or sentences I wanted to read because, this is the Medicine and the Machine podcast. The machine here is what we've been talking about, the ventilation, mechanical ventilators, and related life support. This is when Ibsen said that I could save the patient's life with such a simple method was one of the most incredible moments of my life. We had our first polio patient under control. And then later, the legacy of these polio patients, this is right at the end of the book, continues in the care provided to millions of patients with a wide array of medical conditions across the globe who breathe with the help of mechanical ventilation and receive the complex multidisciplinary care delivered in ICUs worldwide. And I think that is the story that you told that is just so extraordinary. And now I want to connect the dots because what you didn't do was just get into the tech stuff. You brought out the humanity. And that, I think, is what just blew me away because you had pictures and stories of the patients. One, Rosa Abrahamson, you had poetry that she wrote, and you opened many chapters with that, and you traced her life. And another that was central was, I guess, Vivi Ebert.
Vivi Ebert, yeah.
Bulbar polio and was able to live 20 years on from 12 to 32 because of the support she had. I mean, so many patients, you brought out the humanity of what this meant. These are just a couple that I've mentioned. And this, I think, was what made the book, to me, quite extraordinary. It wasn't just technology and innovation and the polio story. It was how you so vividly portrayed these people.
Yeah. Well, I think, working in the ICU, you always have to be careful that you do remember that it's humans in the bed because there is so much technology surrounding them that it's very easy to see the tubes and the machines and think about everything that's going on around the individual. And I think the biggest struggle we've had is to ensure that we continue to remember that we are caring for individual humans in those beds. And that's true of all of medicine. And I know it's something that you care about deeply is how do we keep that humanity and what is the role of physicians? And to me, there is nothing more fundamental in terms of a connection than the idea of sitting at the bedside, literally having that life in your hand in terms of hand ventilating someone. That connection to a patient. But then with polio in particular, these people were awake. They were not asleep. They weren't critically ill in the way we often think of modern critical illness where they need heavy sedation or paralysis and things like, these people were fully, and sometimes still are, of course, fully interactive. And so it was a just really phenomenal experience for the patients, the medical students, everyone involved, because there was so much human connection actually involved with this birth of machinery in a sense.
Yeah, no, that I think was just really startling how well you really got into that, and it was a theme of the book. And another part, of course, is the story that especially Denmark played because of the Serum Institute there with the vaccine. And of course, everyone knows about the Salk vaccine, 1955, but maybe you could comment because unlike SARS-CoV-2 and COVID, where we went 10 months from the pathogen to have a vaccine, this was 1908 polio. It took 47 years vaccine. But Denmark was making monkeypox vaccine, of course, in the recent outbreaks or epidemic of that. They have a long history of science and expertise in this area that you also got into, right?
Yeah, I mean, I felt it was important, although definitely the focus of my book was not the story of the vaccine. That's been told phenomenally in other books, and is also what people associate with polio. And so I wanted to make it very clear that polio, its legacy went beyond the vaccine, which is the first thought people have. But I also felt it was important to tell that story because it runs in parallel. As much as they're treating people with polio, they're also desperate for a vaccine. They're desperate for prevention. And so that runs throughout of sort of all the fits and starts of the vaccine. And I think in general, you kind of alluded to Denmark's place in medical kind of history and science and technology. And given the size of the country, it's really had an outsized influence in many ways with their expertise and developments that have come out of Denmark over the years. And they had a very smooth rollout of the vaccine, thanks to really one individual, Herdis von Magnus, who's a woman who was in charge of the vaccination planning in Denmark. She was in close contact with Salk and Sabin in the years leading up to the development of the vaccine. And they were ready to go really as soon as the announcement had come about the success of the first trials, or the big trials that were done in 1955. And they were not, they didn't have the problems the United States had with kind of oversight of the quality of the vaccine. The Cutter incident in the United States, of course, set back the vaccination kind of drive in. They just didn't, first of all, they were centralized. It's a small country. They had one facility that made vaccine. And so their oversight, it was a lot easier. But they also just had phenomenal scientists who were very careful, meticulous in the way they approached the development of their vaccine and the way they communicated with other scientists. And so it is an important legacy of Denmark, their involvement in these things.
Yeah, that was a bit why I thought maybe you had Danish heritage, just because they come out looking really strong, very, very impressive. Now,
yeah. That said, I should say, one of the things that does also come out is the feeling that there's a very hierarchical in Denmark in terms of the medical culture there compared to the United States. And so there were definitely side aspects to medical care, medical culture. They were very behind in terms of having anesthesiologists recognized as a specialty compared to the United States. So in some things were very well developed. Other things were maybe not quite as strong in that regard. And the medical culture was maybe one of them.
Sure. Well, yeah. And the whole bit about the culture with the academic recognition and authorship and that kind of stuff you got into also extremely well. Now, I did think that the COVID pandemic and polio warranted some comparison, because as you brought out in The Autumn Ghost, there was a miscue about how polio was transmitted, which of course happened with COVID. Everyone was writing about large droplets, and it turns out, it's airborne, and there's great resistance to that theory. So that I think is glaring, along with the fact that a lot of polio is asymptomatic, which people don't understand. They don't realize that.
Yeah.
Before I get into a couple other parallels, if you could comment on both of those.
Yeah, I mean, I think just to talk about the symptomatology, it is really striking that you get asymptomatic transmission of both viruses. They are very similar in that way, that it was hard to track polio initially, and they were really struggled with how was it transmitted, who was at risk, who was going to develop symptoms, who wasn't. And I think it's part of what made it feel so terrifying was this feeling of they never knew who was going to be struck with paralytic polio versus just have kind of cold symptoms versus just not even know they had it. And of course, that's been a struggle with COVID, all these people who are carrying it around not aware that they've got the virus, and how much harder that has made it to contain it or to know who was at risk. So absolutely strong parallels in that regard. And then I've forgotten now the other part.
The fecal.
Oh yeah, the way it was actually transmitted. Yeah, and the fact that they had all kinds of theories about how it was transmitted, and so many people I talked to, and what's really interesting is if you bring up polio, there's so much buried memory of polio. It's just not really talked about much anymore. But as soon as you mention it to people of a certain generation, you get all kinds of memories and stories of either people they know or had polio, or people in their families who had polio, or even just the experience of the fear of polio. And one of them I heard over and over again was parents shutting windows in the middle of summer, not allowing any air to enter because they were so afraid that polio was going to come and get into the house. And of course, once you know how it's actually transmitted, you realize how crazy this is. But I think it brings back the memories of all the hand washing and and the things we did at the beginning of COVID when there wasn't the understanding, and how much increased fear that creates when you don't fully understand the transmission. And then to your point, scientists understood that it was oral fecal transmission before the general public really did. That's clear. And I think you sort of get the same challenge where even once it's established how it's transmitted, kind of getting that information out there to the general public in a way that they can sort of accept and understand, can be as big a challenge as establishing how it's actually transmitted.
Yeah. Important stuff. Now, also the parallel about how you ventilate patients in polio, the discovery, as we discussed, about positive pressure ventilation, mechanical ventilators. And here, in the idea that for COVID, all these people are coming in, maybe not, they shouldn't have gotten intubated and gotten mechanical ventilation, and the benefits of a prone position, which, can you comment as a critical care physician, was this discovery of prone benefit new with COVID, or did we know about this before?
We knew about this before, certainly. There's been many trials of proning in ARDS in general, and it had been established that this was probably beneficial for at least some subset of patients. And so the uptake of it wasn't great, though. And so I think what COVID really did was, well, two things. I mean, the concept of proning someone who was not intubated was also still known as a concept if you go back in the literature, but really was not embraced at all before COVID. But then just the concept of proning for severe respiratory failure in general was, as I said, out there, but not well done, well established. And I think it really pushed people to establish protocols and kind of improve the skills needed to safely prone people in a way that we hadn't seen before. And so, my feeling is that the innovations, the medical innovations, barring the vaccine issue in COVID, were relatively incremental. They were refining things that we already knew. And in fact, some of the issues around whether or not to ventilate was, I think, a little bit of panic in the beginning of we needed to actually change our assessment of patients. And rather than trusting clinical assessments of whether or not someone needed intubation, it was this sort of, well, we must intubate them early. We can't put them on non-invasive ventilation. That'll aerosolize things. And we actually kind of changed what we would normally do for people in ways that were not helpful. And I kind of kept thinking back to the fact that actually a lot of what we did for patients in COVID was exactly what Bjorn Ibsen was really doing for patients back in the early 1950s. It was just good, basic, critical care with some refinements, and then, some med changes and things like that helped improve outcome. But, I do think that I look around in the ICU and think that there's a lot of extra gadgets and extra monitors and things, but really the basics of what we're doing haven't actually changed in 70 years.
That's right. I mean, that came across loud and clear to me in reading the book. The only other one of many that I wanted to touch on is, as you know, there's millions of people, tens of millions of people who are affected with long COVID. And with polio, there's this peculiar, that you wrote about, post-polio syndrome that still a lot of people are not aware of, that can happen 20, 30, 40 years later. And I wondered if you could discuss a bit more about what is post-polio syndrome and what might be the root cause.
Yeah, so I learned all about this doing this book because, as you allude to, I had kind of heard of the term but didn't really know what it was. And I discovered as I interviewed patients who had been cared for in 1952, pretty much every single one of them was telling me about post-polio syndrome and their struggles now. And what it really was or is increasing weakness again for those who had paralytic polio, but also other symptoms. And I think that's the part that really has taken people by surprise. It's a lot of fatigue. There can be pain, and there can be weakness in limbs or parts of their body that they didn't associate with the polio itself, suggesting that there may have been injury to other nerves, limbs at the time that they weren't aware of. And it tends to hit, I think technically it sort of has to start about 15 years after you've had polio. For most people, it seemed more like 30, 40, or even 50 years later that they were starting to get these symptoms. And it is this kind of slow deterioration. And so I interviewed one man who'd actually been in an iron lung in the United States in the 1950s, who is now back on a ventilator after having had what he felt was a full recovery from polio and leading a active life. And pretty much everyone I spoke to needed walkers or canes or were in a wheelchair after having been fully mobile for most of their lives. There's some different theories about what causes it. I think the predominant theory is the idea that the nerves that are left that take over as much function as possible of the muscles kind of get a metabolic fatigue over time, and that that's what you're seeing or these patients are experiencing when their body sort of gets towards the end of life. There's also been some thoughts, is it polio recurring or is it an autoimmune reaction? I don't think there's as much evidence or support for those theories, but we don't really fully know. And it is a diagnosis of exclusion, which I know is not a term people really like, but you do need, they're very clear, you need to rule out other things that cause people to get weak and have fatigue and other things over time. And every time I talk about my book, to medical audiences, I always make sure that I talk about post-polio syndrome because, of course, it's the piece that is in many ways most relevant to caregivers now, because it's something that is there in our patients. And to be honest, I started to wonder how many patients who have unexpectedly struggled to get off a ventilator have maybe had polio in their past, and we just never thought to ask. Could this be manifestations of post-polio syndrome? We're sometimes taken by surprise when someone doesn't do well after surgery or they have a respiratory complication or they just don't wean from the ventilator as you expect. And I wonder if we're underestimating how often it's at play. And so that's something that's changed in sort of my thinking about current care. But I know certainly for those who have had polio, know they've had polio, have post-polio syndrome, they're very concerned about doctors knowing about this syndrome and being aware of it because it does make them more susceptible to things. They're very sensitive to anesthetics, for instance. And if you don't have a provider who understands that, it can be potentially catastrophic.
Yeah, I mean, that's yet another dimension of the book is educating not just the public, but the physician community about this because it's not out there, not a lot of awareness. It's really critical we know about it. Now, you also brought back memories for me in this book that I wrote about in the last part of my Nature review of this wonderful book of yours, whereby I was at University of Virginia in college and I worked night shift as a respiratory care. And I worked in the ICU. And, most of the patients there were on Angstrom ventilators, which I think you turned, or they was called the Cadillac or whatever.
Rolls Royce of ventilators.
Yeah, Rolls Royce, that's it. And, that was the ventilator then. This is 1974, right? And I had no idea where these ventilators came from. And I just assumed they'd been around for centuries, right? Because, I'm just a 19-year-old or whatever. And I saw these people who, were so sick that had like a Lazarus, came back to life. And that's what inspired me to go into medicine. So mechanical ventilation helped those patients for sure. And over time, when I would see them on the night shift and, days later, I thought they were dead. And then now they're, getting extubated. I said, wow, this is amazing. So, it had an impact certainly on my career as well. Now, before we wrap up, I want to ask you what your next project is, because this one had to take a lot of you. This is a feat to do this. This book is, every physician, no less the public should read this. It's just
thank you.
A phenomenal book. But are you ready to, or are you in the midst of delving for another 3, 4, 5 year project like this and do a new book?
Yeah, I've got the bug. I discovered I really do love the writing, and I love the idea that there's so many important lessons out there in medical history, and there's a lot that the public in particular doesn't understand about where things come from, let alone physicians themselves or other healthcare providers. And so I'm interested in finding those stories that kind of haven't yet been told, but are kind of important moments. And so I'm turning my attention, at least for the moment, to tuberculosis, because I feel like there are some stories there to be told that have, despite all the books about tuberculosis out there, that there's still some important stories there to highlight. So that's what I've started scratching at now as I go back to full-time work and continue to talk about polio. That what's interesting is the juxtaposition of the two diseases is actually fascinating because polio isn't eradicated. It is still there. And yet really where most of our time and attention needs to be in terms of the actual disease is in thinking about the long-term consequences of polio, the post-polio syndrome. And you allude to this in your review of, we don't know with COVID-19 what those long-term consequences could be, because viruses are nasty in that way, as we've learned from, EBV and multiple sclerosis and all kinds of other things. That there's all these relationships that are kind of murky and hard to track. And I'm hoping AI may help us in the future if something like this, with COVID, that we'll be able to see these signals for problems down the road with patients who had COVID. And I'm not talking about long COVID, right? I'm talking about sort of something further down the road, maybe different, that is triggered by COVID infection. Anyway, so all of that is those long-term consequences of virus with polio. But then tuberculosis, not a disease I actually know that much about either, but you start reading about it and you think, oh my God, it's everywhere. And it's still everywhere, and yet we're not talking about it. And as multi-drug resistance sort of takes hold, how scary that is for the future, that we are very far from eradicating tuberculosis. I know there is vaccine in the pipeline, and so that'll be fascinating to track and see, whether that can really make the difference. But it is really interesting to go from this disease that when I was researching polio, I thought of as a dead disease. Didn't learn about it in med school, didn't need to know about it, to this disease that is a huge burden in most of the world still. And the opportunity to educate people about that while telling about the history as well is my next task.
Well, you're prescient. During the pandemic, as you know, we saw polio come back in New York State and other places. And because of now some of the anti-science, anti-vax that's out there, it's inevitable we're going to see more polio outbreaks. And as you say, we have very little in terms of control of TB around the world. And even the prospects for a vaccine, it doesn't look like there's anything imminent. So, it's a big challenge. And are you going to anchor that in one particular place in the world, or is this going to be more of a global coverage of TB?
Yeah, no, I'm definitely interested in sort of those single event moments. I'm interested in the early history of the development of the treatments for tuberculosis. So I'll leave it slightly vague at that for now, as I'm in early days yet. But definitely, I love. You alluded to the fact that it's the individual stories, it's the individual people that you get to follow in these stories. I want to make medical history feel exciting and like it's fiction rather than kind of textbook. And so that's my goal in telling sort of about the early history of the treatments and trials for tuberculosis.
Well, what's terrific is you've matched up a rarefied talent of telling stories, making history exciting, and transmitting to your real, humanitarian connect with medicine. And so I will look forward to your future books and works. You're a real gem. We're so lucky to have had you on Medicine and the Machine today. And we'll be following your career with great interest.
Well, thank you so much. It does feel like my book fits very well with Medicine and the Machine, it is about that sort of early moment as humans and machines sort of get combined. And so it's a real honor to get to speak to you about it.